So my name's Becky Booth. I'm Deputy Manager to the Norfolk Safeguarding Adults Board, and it was very pleasing to see that from the poll that Amelia did that some of you already know obviously a bit about us. So this is just a bit more really about the board, and I'm just going to also show you our website a bit. So I've got a few slides here, which I just need to make work. There we go. So this was just a really quick reminder that everybody knows, but thinking about these are the things that we really kind of are really the foundation of all the work obviously the board does and all the work that we do. And for children and adults, it's all about preventing abuse from harm from happening in the first place, but then seeing when something is wrong and taking action when abuse or harm happens. And I thought this was quite useful because I would hope that over the last couple of years, lots of you have seen this See Something, Hear Something, Say Something campaign. And it's quite a good example of where, as a safeguarding adult board, as a children's partnership, and domestic abuse colleagues as well, we all kind of teamed up to try and share messaging. So I think, all the boards and groups and partnerships are trying to work a bit more together, which is really useful in these sort of sessions, and certainly hearing, talking about what Joe's doing. Joe and I have done some work together and hopefully more in the future, and sort of appreciating that safeguarding is, it's almost the cradle to grave kind of thing. So it's really just a reassurance that sometimes I think people get a bit frustrated that one thing is safeguarding adults, another thing is safeguarding children. There's really good reasons for a lot of that, but I think we are all trying to work together to be a bit more effective and joined up where we can be. So Norfolk Safeguarding Adults Board, essentially it's something that Norfolk's actually had for a number of years, but it did become law that every county had to have one from the Care Act in 2014. Now, it is a strategic board, which means essentially it's about generating ideas and plans for what actually happens in practice, and it is director level membership, so it's kind of senior representatives of a lot of the main agencies in Norfolk. The three key partners that every board has to have are the local authority, which in Norfolk is obviously Norfolk County Council, the NHS, obviously the ICB, as I think it is now, rather than CCG, and the police, with lots of other representatives of people I've put on there, including representatives from the voluntary sector, but it's also district councils, Health Watch, Mental Health Services, Care Quality Commission. So all those sort of people that where we're organisations and agencies working together to safeguard adults that have care and support needs and may be at risk. The Safeguarding Adult Board meets every 2 months. We have an independent chair, so if you can imagine, it's a multi-agency board. So it's really important to have a chair that doesn't belong to any one of those agencies and is really independent and able to challenge the various people in the room to make sure that safeguarding is happening in the right way. And there's a small business team. So many of you may have heard of our board manager, Walter Lloyd-Smith, who was been working on his own for a number of years. And then 2 years ago, just over 2 years ago, I came into post to join him as deputy. We have 2 board coordinators that help us kind of administrate a lot of the work that we do, and the board meetings and all the other meetings that we get involved with. And we also share a communications officer with the Safeguarding Children Partnership, which again is helping us in that joined up work. The key responsibility of the board is essentially protecting adults from abuse, reducing the risk of abuse, and supporting people to stop abuse where it happens. And our absolute main objective is to make sure that local safeguarding arrangements and the people responsible for those are acting appropriately to help protect adults in its area who meet the criteria under Section 42 of the Care Act. So although our absolute main remit is what are known as adults at risk under the legislation, so that's where the law tells us we must absolutely make sure people are supported and protected. To an extent, as a board, we also have responsibilities for raising awareness in our communities and supporting particularly the preventative work, so the work that happens to stop abuse happening at the beginning, which then prevents them coming into that Section 42 criteria. So we're always around that preventative thing. Some of the key themes we've got going on this year are around that prevention work, really focusing on collaborative working, recognising and supporting informal carers. We've been doing some work with domestic abuse and older adults, again, recognising it and getting that prevention side. And we're also doing some particular work around improving understanding and use of the Mental Capacity Act. I also remember, because we're doing a lot around self-neglect and hoarding as well. So one of the things with safeguarding adults, it's a very wide remit, that can cover a huge number of people. So we have a lot of spinning plates, but we are quite a small team that work to put what the board wants to happen into practice from a multi-agency perspective. One of the most common questions or mistakes I think that gets made sometimes is people think that the Safeguarding Adult Board is part of Norfolk County Council, and it's really important to say it isn't. It is a multi-agency strategic partnership. It's a kind of standalone thing. We have to be employed by somebody. So myself and Walter and our other colleagues sort of need somebody that can employ us. So we are employed by Norfolk County Council because they're one of the main partners, but we are separate. We have our own website, which I'll show you, and we have our strategic plan, business plan, all the rest of it. So Norfolk County Council is one part of the board, but the board is an amalgamation of all those organisations. So what sort of thing do we do as the business team sort of day to day? So I've already mentioned some of the themes that
Becky,
the strategic board kind of pulls out.
But yeah, there was just a question that I think might be worth answering now is, so Natalie's just asked, what exactly is the S42? What exactly is S42?
Okay, if I just skip, if I show you this particular slide, so I can't see the chat. I'm saying apologies. I'm not very used to Zoom. I don't know where my chat box has gone. So in the Care Act, which is the foundation for all safeguarding adults work, so it has a specific section in the Care Act, which is section 42, and it sets out the legal duties on the local authorities, Norfolk County Council, and all partners, and it really says these are the things that you must do to support and protect people and to respond when harm or abuse is happening. So what we tend to say is, so if you ring Norfolk County Council and you're really concerned about an adult and it's what you might think of as making a safeguarding referral, we maybe don't talk about it in quite that way anymore. But if you like, a section 42 inquiry is where Norfolk County Council will look at that concern and make inquiries and potentially take action to stop that harm or abuse from happening. So it is worth having a look at, and I'll show you on the website where there's some more guidance about what is section 42. But one of the things that the board is very keen to kind of promote an awareness of is that section 42 is the tip of the iceberg. So in a way, that's often where, abuse and harm has very definitely happened and action needs to be taken to stop it. But you have to fit into a particular criteria to meet the eligibility, if you like. So you have to be a person who has care and support needs. And again, I can share more information about this via Amelia. Person with care and support needs, so you have to have, for example, some kind of additional need or physical disability or mental health need, which means that you need additional help with your day-to-day activities, and without that help, there's a significant impact on your well-being. So that's kind of like where the person has a need underneath the Care Act. So that then tells the local authority that they have a duty to do something in terms of the safeguarding. So you have to have that need. You have to be subject to abuse or harm or risk of it. And you have to be unable to protect yourself from that abuse or harm because of your care and support need. So it is quite a specific sort of the tip of the iceberg will be people who fall, adults, because there's, think about how wide the adults 18 to, whatever. It's a huge number of people. So in fact, the people that will fall into that section 42 category is relatively small. But it doesn't mean that if you don't fall into that, just because the local authority, Norfolk County Council, doesn't have to do something in terms of the safeguarding inquiry, the point of this sort of pyramid approach is just to say that we still do safeguarding with what we call a small s. So it's preventative, supportive. If you're a victim of a crime, you still will go through police pathways. But if you're an adult with needs who can't protect themselves, you'll be more supported through that criminal pathway, if that makes sense. It's a big thing to cover, and we haven't got very much time, which I feel a bit bad about, but it is a bit complex. And maybe the thing to do as well is to, if you go on the safeguarding adult training, it will go through what an adult at risk is, what Section 42 duties are. So I'm sorry that I use Section 42, and that's a bad thing for me. It's sort of shorthand. Does that help? And I still can't see where my chat screen is, so can't see anything.
Hang on, let me. Yes, thank you for that, says Natalie.
Perfect.
Yeah, we'll have some other questions, but we'll wait until you finish your presentation as well.
Okay, so and do just anything like that. If we can't answer it today, then I'll certainly come back to you and give you more details or guidance of where to go to get the answers. So what sort of things do we do every day? So the Norfolk Safeguarding Adult Board, we have a multi-agency safeguarding policy, which essentially tries to direct all partners in terms of how they approach safeguarding adults' work. And we also do some template policies, so I'll show you that on the website in a moment. So we have a voluntary organisation policy that was developed with the support of Amelia. We do quite a lot of work with campaigns and resources to raise general awareness. So that is primarily with people that work with adults, but also with the public. So, for example, one of the things Walter's doing is we're supporting Norwich Pride. So we do try and get involved in events. There was a learning disability event at the Forum a few weeks back that we went to. And slowly, as we're getting more face-to-face or getting involved in those sort of things. We have posters, leaflets, we have roller banners, we have pens, we have bags. We also have some sort of merchandise, for want of a better word, that we can share that all just talks about safeguarding. I'm thinking this, you probably can't see something, my screen's blurred, but we have some leaflets and things. So if you need and would like that sort of thing, then you just need to email us and we can post stuff out to you. We do quite a lot of guidance on the website. So my background is actually in social care, so I'm a social worker, and before coming into this, I was working in the safeguarding adults team for Norfolk County Council. So since I've come into post, I've been supporting with writing some of the guidance. So again, we're always on the lookout for suggestions of what would be useful from yourselves. But again, I'll show you where that is on the website. We promote training to support good practice. So a bit like Joe, there's some training on our website through our partners, St Thomas Training. And I'll again show you that in a moment. We work alongside and support loads of different groups and partnerships in safeguarding. We have local safeguarding adult partnerships. We have our website, which again we do. So it's not, again, it is just our small team doing this. And we had a big refresh last year that I did with my colleague Andrea. So we went through everything and tried to update it and make it much more accessible. We have a Twitter account. We do work at local, regional and national levels. So we get as involved as we can and we share our information. So for example, we did a Tricky Friends animation, which is about supporting safer friendships, mainly focused on people with learning disabilities and autism. But that's been picked up by around 30 other safeguarding boards. It's been used for children as well. There's been an adaptation for children. So we've had really positive responses to that, and we get involved in various research projects, again, always with a safeguarding focus. Part of my specific remit is I offer direct support to local councils so that we're getting more consistent approaches across Norfolk. We've got 7 different district councils and areas, so it's about just trying to promote, the same thing happening in each place. The board has a duty to undertake safeguarding adult reviews.
Trying to get hold of you.
Oh,
it's
sorry,
the
Philip, I think
list
you
of
might
local
need to mute
messages
yourself.
back, which may not be getting through. So I might have to try and contact.
Hi.
Oh, sorry.
Just okay. Was that coming from you, Becky, or was that from
it was Philip,
on
wasn't
the meeting?
muted,
Okay, I think everyone's muted now. So
yes. Good. So yeah, safeguarding adult reviews. So there we have a duty. So in situations where somebody has died or come to very serious harm, and it's as a result of abuse or neglect, and where the agencies who are involved could have worked together better, we have these big reviews to look at what lessons we can learn and then how to get that learning out into our partnerships and improve practice. We also get involved in domestic homicide reviews, complex cases. We support with general queries. We don't, obviously, we do get queries through our website where, again, people think we're Norfolk County Council, so sometimes they're sharing information with us that they shouldn't, but we pass that on to Norfolk County Council so that people are getting through to who they need to. And obviously we share information through our networks. So I'm now just going to flick and show you our website. So I hope you can see that all right without showing everything else. So we have this sort of, I believe it's called a mega menu at the top. So if you hover over it, it will give you a load of different drop down boxes. Also, if you click on the specific buttons, it gives you a bit more information. So there's their information about us, the thing around who we are and what we do. So it's a bit similar to what I'm showing you today, but a bit longer. So yeah, it tells you sort of who we are. And then you can kind of navigate around and see what we do. So we've got our annual reports here. So every year, again, by law, we have to publish an annual report. We publish the meetings, the minutes of our meetings. We have our strategic and business plans here. So all those kind of things in that first section. We have a thing around our current campaigns here. So here you can see the see something, hear something. We've tried to respond to things that are happening and changing. So here we have some information about Ukrainian refugees. We've got a version of Tricky Friends, actually, which is now also in Ukrainian. And you can download things here. So there's some social media things. And elsewhere we have the posters you can download. There's also information here about our safeguarding adult partnerships. So we have 5 across Norfolk, and again, I support these. And each month we get together and talk about different topics. And on here you can get an idea of what the LSAPs do. When they meet is here, and the topic's going to be discussing. And we also do webinars. We've started doing this since the pandemic. So these are actually open to anyone. We develop them with our locality safeguarding and our partnerships, but because they're online, to an extent, anyone can join them if you have an interest in safeguarding. So this would tell you, for example, that on Monday, the 18th of July, we have somebody George from HSBC, very enthusiastic chap, who's coming to talk to us about essentially tackling fraud and financial abuse. And our topic this month is adult exploitation, so it's linking in with that. So these are things that as organisations you're very welcome to join, either the safeguarding partnerships themselves or come along to the webinars. In our protecting adults area, this is where we have try and put together all the information around actually what you do in practice. So we have working with adults at risk, and this is a link to our policies and procedures. We have something around mental capacity and safeguarding, again with guidance here. We have the policies and procedures. We have our main multi-agency safeguarding adults policy. We have a Norfolk self-neglect and hoarding strategy and practitioner guide is here as well. And then if we go into our practice guidance area, so as you can see here, we have guidance, not too complex, but obviously there is detail in there to help you understand it. Oh, I'm hoping you're all right. Look, my computer does not like Zoom. So for example, we have something here about domestic abuse and older adults, which give you information around the sort of getting a bit like Joe with the history of it, tells you a bit about why it's particularly hidden, the fact that a lot of statistics don't even count domestic abuse over a certain age. Here's quite an interesting one. We have children and adult safeguarding and overview. So this was designed to help people kind of understand the similarities and differences between safeguarding children and safeguarding adults. So it talks about that threshold. So talking about the section 42 here, where the thresholds are for children, the types of abuse that apply, and some of the key principles. So that's just an example of one of the practice documents. This is sometimes quite useful if you want to know what happens when you make a safeguarding adult referral. So we've slightly changed the language we use, but this is a slightly older document, but it still stands. This tells you what happens when you ring Norfolk County Council and the sort of things that happen to it as it goes along. So you've got a good idea of what a safeguarding, how a safeguarding concern is sort of moved along. So you can go along and have a look there. We also have, for sort of very quick things, we have 7-minute briefings. So this one here is on safeguarding versus safeguarding. So this again just shows you the difference between a safeguarding inquiry under section 42, but then safeguarding with a small s, and about the support you might offer people, even if they don't meet that section 42 criteria. And that links through, so that's under our publications, information, resources. Under abuse and neglect, this sometimes get missed a bit, I think, but we do have types of abuse. And so here you can find information on all the different types of abuse. And where we've popped little videos and things in to try and make it, we have links to what's happening in Norfolk. So hopefully it's sort of reasonably straightforward. Training and development. So we have here a national competency framework around safeguarding training, safeguarding adults training, and we have links to available training. A lot of the St Thomas training here is free to unpaid volunteers, which isn't always known. It's something that Norfolk County Council Adult Social Care Commission. So it's not, the Safeguarding Adults Board don't pay for this. It's just that Norfolk County Council is one of our partners, commission it, and as part of that, they open it up to other organisations. So it is worth bearing in mind, they do 3 for 2 offers. So there is a safeguarding awareness, which is sort of basic safeguarding. There's safeguarding know-how, which is really more for sort of service managers. And we also have this new child and adult exploitation e-learning, which has been developed with the Safeguarding Children's Partnership, the Safeguarding Adult Board, and the Community Safety Partnership. So again, that is free e-learning to all on there around adult exploitation. So one of the things I skipped over here is we do actually have an area for volunteers and community groups. Now, this is something that we'd really like to develop, but as I said, we are a tiny team with a huge amount of work on the go. So I'd be interested if any of you would have a look at this. It is, you know, small, and we obviously mainly link through to colleagues. There's a bit of an old coronavirus advice leaflet here. But here we also have our model policy for voluntary organisations. This is an area we'd like to improve. So very interested to hear if there are any suggestions from yourselves on how we can make that more useful for you. All right then, so very quickly, so I won't go through that anymore because you've already kind of had a chance to look at it. So last slide really is around just thinking about some key themes. Safeguarding is massive. So this is just things that I kind of picked out really, but it's just about remembering, particularly in your roles or volunteers that are going into situations that abuse or harm can be intentional, unintentional. So it's often a thing of somebody didn't mean to do that, but it is important to remember that it is about the impact on the person, even if it wasn't meant. There are no easy one-size-fits-all approaches in safeguarding, which is something that as a board we often hear why was this done differently to that? The reality is, and indeed the law tells us and all the guidance tells us, you have to treat every single person as a unique individual. And there are so many factors involved in safeguarding and the way that we live our lives and our mental capacity and our relationships, that we need to look at each one on its own merits. Making safeguarding personal is something that we really push, about keeping that person central. You know, what's risky for one person is less so for another. And we're really pushing professional curiosity. It's a very key theme in a lot of the safeguarding adult reviews, and indeed domestic homicide reviews, and I can't think what they're called in children now, serious practice reviews or safeguarding practice reviews for children. It's all about not necessarily investigating concerns or things that people tell you, but you can ask if somebody's all right. You can say, oh, that's a funny bruise you got there, how do you manage that? You can ask what people want to do or if they feel safe. And there was just a bit about sharing your concern. Okay, so for more information, obviously have a better look at our website. You can follow us on Twitter. It's more Walter's bag than mine. I get a bit sweaty if I have to do something on Twitter because I always worry I'm going to get it wrong. And on our website, we do have this link, which I'll just briefly show you at the bottom of every page on the website. You pop your name and email address in there. Walter does a great blog every month where he manages to link very strange things to safeguarding themes. And obviously also have a look at our locality safeguarding adult partnership information. And if you'd like to come along, again, just contact us and we'll be able to get you an invite from the one that's most suited in your area. So that is me, finally. I shall stop sharing now